This is Bob Flaws with another one of our Blue Poppy YouTube clips. And what I'd like to talk about in this clip is a very common misunderstanding about blood-quickening medicinals. Blood-quickening medicinals are the medicinals that we use to dispel stasis, to quicken the blood and dispel stasis. There's an idea that many Western practitioners have that blood-quickening medicinals can be too moving and therefore can make the blood move too much and lead to unwanted bleeding. This is really a baseless idea, and it comes from not really understanding the idea of quickening. Maybe that's because people use the wrong word. People use other words like invigorate the blood and accelerate the blood or move the blood. Quickening the blood means two things. One, yes, to make the blood move more quickly if it is static or stagnant. The other is that it brings the blood back to life again. This is based on the idea that static blood prevents the engenderment of new or healthy blood. One of the issues here is that people get stuck in their head and think about Western concepts like intravascular embolisms, and then immediately assume that that translates as a blood stasis, which is a very dangerous assumption to make. Blood stasis is a Chinese medical idea that is defined by the signs and symptoms that Chinese medicine says, not any Western medical ideas about the blood or the vascular system. When we say that we're going to quicken the blood, this is an attacking and draining technique. And if you do it too much, if it's not appropriate, if it's overdone, you'll damage the blood. And because blood and essence share a common source, you can damage yin. If you damage the blood, you could damage the qi. But and qi vacuity could cause bleeding, and yin vacuity heat can cause bleeding. So I can't say that categorically blood quickening medicinals will never ever result in bleeding. But you can use blood quickening medicinals without having to worry about causing bleeding in the overwhelming majority of cases, as long as you prescribe them based on Chinese medical pattern discrimination and not some Western medical idea about the vasculature or the quality of the blood or the presence of some neoplasm or tumor. If you base your use of blood quickening medicinals on the traditional Chinese definitions of blood stasis, and then use the blood quickening medicinals for the proper duration at the proper dose, you're not going to have any problems in terms of causing bleeding. Because it is attacking and draining methodology, we only use it until it has done what it needed to do, and then we stop. If you continue on past the time you should, yes, you will damage the righteous, meaning the blood, yin, possibly eventually even the qi. And you don't want to use it in too big a dose. You want to use it in a dose that is commensurate with the condition at hand. And you also want to use the right blood quickening medicinals. There are three strengths, we can say, of blood quickening medicinals. Medicinals that quicken the blood and transform stasis, medicinals that quicken the blood and dispel stasis, and medicinals which quicken the blood and break stasis, break the blood, meaning that they break up tumors. The last category is the most heavy duty, the most extreme, and therefore if they're used erroneously, then they're the most likely to cause side effects due to over attacking and draining. The medicinals that are the mildest, things like dongui and honghua and taoren, these medicinals not only quicken the blood, but they also do have some nourishing ability as well. So they're not just attacking and draining, they're also somewhat supplementing and nourishing. So if you use the right level of quickening the blood at the right time, for the right duration, and the right dose, you really don't have to worry much about causing any kind of bleeding. Blood leaves the vessels because of chi vacuity. It leaves the vessels because of heat, forcing the blood outside the vessels. It leaves the vessels because of blood stasis. You've got to understand that quickening the blood is one of the fundamental methods of stopping bleeding when that bleeding is due to blood stasis. So my point here is that blood quickening medicinals do not necessarily cause pathological bleeding. They frequently are employed to stop pathological bleeding. So it's very important that you understand the concept of quickening the blood within Chinese medicine, and that as a group, we Westerners need to outgrow this erroneous idea about blood quickening medicinals quickening the blood in some sort of mechanical way, causing it to spill over. Okay, that's what I have to say about that.